consultations with other experts in various fields, including an anesthesiologist, Dr. Collins?
Yes.
Did you also reference the transcript of Dr. Murray's interview that was played to the jury the last 2 days? Did you read through that interview transcript?
Yes, I did.
Did you also, as an opportunity to assist you in your investigation, seek out medical records from Dr. Murray regarding his treatment of Mr. Jackson on that day?
Yes.
Were you able to obtain any?
No.
At some point following your receipt of the toxicology results and following your consultations with the various medical consultants, were you able to ascertain and make a determination as to the manner of death regarding Michael Jackson?
Yes.
And what was the manner of death?
The manner was homicide.
And on what did you base your conclusion that the manner of death was homicide?
Well, there were several issues. Number one, circumstances. For example, Dr. Murray's statement to the police indicated that the propofol and other medications were administered by another person. Secondly, the propofol...
I'm sorry, that Dr. When you say by another person, you mean that Dr. Murray being the other person. When you refer to other person, you mean other than the decedent. Is that right?
Yes.
Okay, so you're commenting that Dr. Murray admitted to administering the benzodiazepines and the propofol.
That's correct.
Okay.
Secondly, there was not an appropriate medical indication. The problem that Mr. Jackson was having was that he couldn't sleep, and it's not appropriate to give propofol in that situation. The risk outweighs the benefit.
And did you also consider the setting in which this was taking place?
Yes, the setting was outside of a hospital or clinic. It was apparently in a home, and so there were a number of things that would ordinarily be used with propofol that were not available in this case. For example, there was not an EKG monitor. There was not a precision dosing device like an IV pump so that you know how much propofol the doctor is giving him. There was not equipment available to resuscitate Mr. Jackson adequately if he were to stop breathing. For example, there was not an endotracheal tube or medication that could be used to improve his circulatory function. And then finally, the circumstances, from my point of view, do not support self-administration of propofol.
And why is that?
Well, Dr. Murray tells us in his statement that he gave Mr. Jackson 25 milligrams of propofol, which is not a very large dose. And in order to keep him asleep, he had to give him additional propofol from time to time. He then went to the bathroom for 2 minutes, and when he returned from the bathroom, he found that Mr. Jackson was not breathing. So in order for Mr. Jackson to administer the propofol to himself, you would have to believe that he
This is speculation.
It's basic.
I'm going to overrule the objection under 801, 802, and 804.
Thank you.
Let me finish, please.
You would have to assume that Mr. Jackson woke up. Although he was, at least to some extent, under the influence of propofol and other sedatives, he was able to somehow administer propofol to himself. The circulation time of the body passed. In other words, if you inject propofol in the leg, it takes a while for it to get to the brain. And then he stops breathing, and all of this takes place in the 2-minute period of time.
Okay. And that scenario does not support self-administration from your perspective. Is that accurate?
Yes, to me that scenario seems less reasonable.
Less reasonable than what?
Well, the alternate scenario would be, in order to keep Mr. Jackson asleep, the doctor has to give a little bit from time to time, which is, in this case, going to add up to about 2 or 3 tablespoons of propofol per hour. This is to keep him asleep. Now, we did not find any kind of precision dosing device, which means that essentially the doctor would be estimating how much propofol he was giving to come up with this 2 to 3 tablespoons per hour. And I think it would be easy under those circumstances for the doctor to estimate wrong and give too much propofol.
And some variation of that scenario you find to be more likely.
Yes.
Now, once you were in receipt of all the materials you've referred to, the toxicology findings as well as the consultations, your review of the defendant's interview transcript, as well as your evaluation of both the internal and external organs and components of Mr. Jackson, did you determine what the cause of death was as it related to Michael Jackson's death on June 25th, 2009?
Yes.
What was the cause of death, Dr. Rodgers?
The cause was acute propofol intoxication, and the contributing condition was benzodiazepine effect.
And what do you mean by that? The contributing condition was a benzodiazepine effect. What does that mean?
There were 2 additional medications in Mr. Jackson's system, which were midazolam and lorazepam. Both of these are classed under benzodiazepines, and both are sedatives. So although the main thing was the propofol, there was a smaller contribution from these additional sedatives.
Okay, and would those additional sedatives work to exacerbate the effects that the propofol would have as far as respiratory and cardiovascular depression?
Yes.
So the combination of the sedatives as well as propofol could result in a quicker or enhanced depression of the respiratory system, causing someone to stop breathing, for example.
Yes, that's a possibility.
And the combination of the lorazepam and midazolam along with the propofol could also result in quicker or enhanced depression of the cardiovascular system and the heart, and cause the heart to stop essentially beating, correct?
Yes, that's possible.
And that is what you mean when you say the cause of death is acute propofol intoxication and the contributing condition was the benzodiazepine effect.
That's correct.
Thank you. I have nothing further, Your Honor. Oh, I'm sorry. I did want to ask one additional question.
Sure.
Dr. Rodgers, was a diagram prepared in this case? A diagram of Mr. Jackson and various observations that you made?
Yes.
I do have that diagram, Your Honor. I'd ask that be marked Peoples 207 for identification.
It's marked.
Dr. Rodgers, showing you Peoples 207, does this note various IV puncture sites, either through resuscitative efforts or otherwise?
Yes.
Okay. And some of these are noted on the diagram. You note here at the top of Peoples 207, does that say endotracheal tube?
Yes.
Okay, and you have on the neck a puncture through resuscitative efforts. Is that accurate?
Yes.
And then you go through identifying certain puncture areas on the diagram of what would be Mr. Jackson's right arm,
That's correct.
as well as where I'm pointing here, as well as his left arm.
Yes.
And going down the diagram, you indicate a puncture mark just below, I guess, what would be the left knee. Was it your understanding that that was where Dr. Murray had administered the IV?
Yes.
Thank you, Doctor. Did you also, in your evaluation of this case following the cause of death determination, did you observe the empty 100 milliliter propofol bottle, which has now been marked Peoples 30 for identification, but was LAPD item 106?
Yes.
And did you notice something unusual about the rubber stopper that you noted in your documentation in this autopsy?
Yes.
And what did you note unusual about the stopper? Again, I'm referring to Peoples 30, which was previously LAPD item 106.
The center of the rubber stopper has a more or less linear opening in it, so it did not show any needle punctures, but only this one opening.
And the linear opening in the rubber stopper that you observed, were you able to draw any conclusion as to what would have made that linear opening in that propofol bottle?
Do you have familiarity in this area, based on your experience?
Yes.
Counsel can inquire further about that experience. Right now, I'm going to sustain the objection absent further foundation.
Thank you, Your Honor.
Thank you.
Let me first, if I could, mark the photographs, Your Honor. I have 3 separate photographs. May these of the top rubber stopper of LAPD item 106, Peoples 30. May these be marked